Best strains for PTSD and anxiety, and medical marijuana Dr. Texas. Post-traumatic stress disorder and anxiety affect 3.5% of adults in the United States every year. According to the Anxiety and Depression Association of America, PTSD affects nearly 8 million Americans. Although anyone can develop PTSD, the condition affects women more than men. According to the National Center for PTSD, about 10% of women will develop PTSD at some point in their lives. PTSD behaviors are often accompanied by acute anxiety. There are certain factors that can make a person more likely to suffer from PTSD. A person with a family history of PTSD or anxiety has an increased risk of developing the condition. A person's natural temperament or the way a person's brain regulates certain chemicals can influence whether or not the person is more likely to develop PTSD. How does marijuana help PTSD and anxiety? Medication can be used to treat PTSD symptoms such as anxiety, sleep disturbances, and depression. But these medications are not always successful and they also pose the risk for unpleasant side effects. PTSD can be alleviated with cognitive behavioral therapy, but it is not always successful. Behavioral therapy is not always effective for many PTSD patients. While medical research continues to develop a lasting cure for PTSD, some patients are finding relief from it through the use of medical cannabis. How is medical marijuana an effective treatment? Studies have sought to figure out why some people are more susceptible to PTSD than others, and these studies have come to interesting conclusions. The researchers found out that people with PTSD had considerably lower levels of anandamide, a neurotransmitter, than people without PTSD. Additionally, people with PTSD had higher numbers of cannabinoid receptors. These cannabinoid receptors are activated by anandamide and other neurotransmitters. Medical cannabis for PTSD and anxiety. Most evidence suggests that the therapeutic use of cannabis can significantly improve the quality of life for people with PTSD and anxiety. Best strains of marijuana for PTSD and anxiety. There are numerous marijuana strain options available that may help reduce or alleviate symptoms of PTSD. First, OG Kush. OG Kush has a pleasant, euphoric effect and it is considered an ideal strain for PTSD patients. It has a high THC content, usually between 20% to 24%, and a low CBD content, which is generally about 0.2%. Second, Blue Dream. Blue Dream is a sativa dominant strain and it's one of the most popular strains among PTSD patients. It has a high percentage of THC, usually between 17% to 24%, and is considered a well-balanced hybrid. Third, Pineapple Express. It has smooth and well-balanced effects that leave users feeling clear-headed. It has a high THC content of about 20%. It has low CBD content of about 0.1%. Fourth, Canatonic. It has a high CBD content ranging from 6 to 17%. Canatonic strain provides daytime relief and can also produce a mild high. Fifth, Master Kush. Master Kush is an indica strain and it is not recommended for beginners. It is recommended for PTSD patients who struggle with insomnia, marijuana PTSD and reduced risk. When prescribed medications do not help, patients with PTSD tend to take drugs like marijuana and alcohol to alleviate their symptoms. It is very important that access to medical guidance be available to people with PTSD who wish to use marijuana to manage their symptoms. If people with PTSD were allowed to use prescription cannabis, the risk for side effects, overuse, legal complications, and stigma associated with cannabis use can be reduced or eliminated.